있다고 그러는데 지금 아직 잘 모르고 그래서 오늘부터 이 난독증 알리기 운동을 좀 시작을 해서 한국에도 많이 있다는 거를 좀 알아내야 될 것 같습니다. 준비, 눈에 뿌려 빠라 또.
And unfortunately, I don't speak any Korean, and I hope you understand my English. Anyway, I will speak slowly. I don't know if it is better to give the conference in Italian and translate in Korean, but it was scheduled in English. So here we have also the representation of the Association of Dyslexia and Italian Association, Associazione Italiana Dislessia, and in this moment I am also the chairman of this association, and I think it is important because we are very young, respective to the other dyslexia association in Europe that are 25, 30 years old. We have only 10 years. We are 10 years old next year. And maybe this is a good occasion to establish some relationship with the Korean Dyslexia Association and to give a sort of stable relationship with a younger association. First of all, definition of dyslexia. This is the official definition of dyslexia by IDA, International Dyslexia Association, that stands that dyslexia is a specific learning disability that is neurological in origin. That means that there are some characteristics that we see after in our brain, in brain of dyslexic children that differs from the other brains, but there are not lesions. There are differences that we have also in other part of our body, and that give origin to different behavior, especially when we read, when we have to read or write or calculate. The very important thing is to keep in your mind these few words. You have also to consider that these difficulties typically result from a deficit in phonological component of language, but it is more specific, and I think furthermore I will clarify this concept. Dyslexia is most often associated to a cluster of symptoms, mostly coming from a specific language impairment. That is, very often dyslexic children before school age show language impairment deficits, slow acquisition of language. And they have short-term memory deficit and also a deficit in rapid automatized naming. That is, they have some difficulty to repeat fastly numbers of colors, very common words. And we don't know why this speed deficits, it's so hard to modify during the development. And also in adult dyslexic people, we have these two markers, short-term deficit, verbal, and also RAN deficit, we call RAN deficit. It is also often associated with ADHD, that is attention deficit and hyperactive disorders, especially in childhood, because when children go at school, attending learning of written language, and they are not able to do this, they often show some hyperactive behaviors. The exact causes of dyslexia are still not completely clear, but anatomical and brain imagery studies show differences in the way the brain of a dyslexic person develops and functions. We have some morphological differences that were described by Galaburda and colleagues, but now we are mostly interested in activation differences in the brain, in some areas of the brain, demonstrated by functional MRI. That is, that if we analyze our brain and the brain of a dyslexic person, we can find that in some area of temporal cortex, we have less activation during reading. Oh, this is just to show you that it is impossible to read that in the, for instance, that area and that area are compromised in dyslexic persons. Compromised in the sense that its function differs differently. And in particular, this temporal gyrus, inferior temporal gyrus, but this is not so relevant in this presentation. But this is most important. Unfortunately, I didn't translate in English, but you see this is the biological level, and is that you can see here, biological level. And this small differences in the brain determines some deficit in verbal memory, deficit in phonological awareness, and slowness in lexical access. And so they have at the behavioral level, this is the cognitive level, the behavioral level, you have poor reading, very poor spelling, that is disability in writing, and so on. This is the, you know, the chain of the consequences of the brain differences. We have 5 inclusive criteria to identify developmental dyslexia. We call developmental dyslexia the constitutional dyslexia, and we can call acquired dyslexia an impairment in reading after a stroke or a major neurological disease. And developmental dyslexia are 5 inclusive criteria. Reading skill to standard, deviation below school grade average, nonverbal intelligence more than 85 IQ, normal classroom attendance, impairments tend to persist across school. That is, the persistence of this impairment is one of the marker of this disease, and some social and psychological effects. The diagnostic is based upon discrepancy between intelligence and reading level. That is that as we can measure the cognitive functioning of a person along a line, and we can also measure all the behaviors of, in neuropsychology, we can measure all the behaviors of a person, and in this case, we can, the reading skill analyze, and we have a point called average, and this is the average, and if the measure, you take into account if the measure is well established, in this average you can count the 68% of population. That is, for instance, if the measure is the IQ, measure of cognitive functioning, you have between this point and this point, that is 85 to 115, the 68% of persons. So this is the normal population. Under this level, under this level we have a weakness level in which we have the 13% of population, and 13 is very good, and the deficit now. So when we say below 2 standard deviation, we mean this level. This is 1 standard deviation, this is 2 standard deviation, so below 2 standard deviation. So, a dyslexic has to be cognitive functioning inside this level, reading functioning at this level. This is the representation, the graphic representation of a dyslexic. And here you can have the discrepancy. You know, this is called discrepancy index because it can vary depending on the severity of the reading level, but also on the brightness of the cognitive functioning. Dyslexia assessment. When you have to assess a dyslexic child, you have to do a lot of things, a developmental, medical, behavioral, academic, and family history, a measure of general intelligence, information on cognitive processing, memory especially, attention also, this is it's called now executive functioning, auditory processing. Less important is reasoning abilities because they are good in dyslexic children. And we have a lot of well-known people in the world that were dyslexic at school. For instance, Albert Einstein. We have to test the language skills, oral language skills, and some educational. And at the end, classroom observation is very useful. At what age we can test an individual for dyslexia? At any age after the beginning of the school, at any age. Not before. Before, you can hypothesize a following dyslexia if child has a language impairment or if he has a family history of dyslexia. This is the 2 markers for a risk. And there is a very important study in Finland, made in Finland, in which they analyze a lot of couples and based on the family risk, and they establish 100 at-risk children and measured against a control of 100 non-at-risk children before the birth, you know, only based upon the family history. And they followed for 8 years. And 97 of these children were dyslexic. 97 over 100. But if you test a child during the first grade, you have to be alerted because maybe you are identifying a slow learner, not a dyslexic. So you have to make 2 different evaluations over 3 months, because you can, in this way, to test the development during 3 months and calculating the rate development. And basing on the rate development, you can establish very early if this child is dyslexic or not. After the end of 2nd grade, every time is good to make an evaluation and to establish if one is dyslexic or not, one child. What happens after evaluation? After evaluation, if needed, we can start with a re-educational training, depending on age, because after 9, re-education has very poor effect. In some European countries, the official insurance do not pay for speech therapy after 8 of age, do not pay any treatment after 8, because they consider this an evolutionary window that is closed. And after this age, you can only manage with your problem, but not have advantage from the education. In Italy, we don't say this, but after the primary school, we don't treat any persons because it's just done, It's very important to make a specific intervention at school. This is very, very important because the dyslexic child stays a great part of his life at school, and their problems are mostly at school, not outside the school. Also, dyslexic adults should receive specific suggestions for coping strategies and remediation. Early detection and intervention. It is recommended as individual empowerment on learning should be given from the early stage. This instruction should be provided by skilled professionals, speech therapists, and teachers. This is very important. Interventions have to be intensive and targeted, very specific, not generic. Graphophonics re-education seems to be more productive than others, based only on phonology, for instance. If you train a child only on phonology and you don't teach him some phonetic translations, you don't get the same results. And in literature, we find a lot of this